Well, good morning, everybody. Let me first just welcome you this morning. Just wanted to make some brief remarks before I get started on the reason we're here today. I just want to extend my thoughts and prayers to Deputy Brandon Cunningham of the Paulding County Sheriff's Office. Just a tragic shooting as he was responding to a domestic dispute. I talked to Sheriff Gullidge a couple of times over the weekend. I know we had a lot of local and state law enforcement that responded, and our hearts are heavy with the loss of one of our bravest and one of our true heroes, and just young children. And I just ask all Georgians to keep their family, the department, and that community in your thoughts and prayers. Also, just want to thank so many of you for being here this morning. We got some great folks at the table here with us, but a lot of other people that have been working very hard on healthcare options in our state. And, really good public policy. Members of the General Assembly that are here with us today, House and Senate staff. Just want to thank them for being here. Best first lady in the country, Marty Kemp.
Hey.
We appreciate her being with us. Our Insurance and Safety Fire Commissioner, General John King, who's worked so hard that you'll hear from this morning. Commissioner Russell Carlson, but even more important, his staff and hardworking folks at the Department of Community Health. We appreciate all of you and what you've been doing. Jason Bearden with CareSource here with us this morning. Wade Rakes, who's representing Peach State Healthcare Plan, and then Mel Lindsay from AmeriGroup. Just want to thank all of you for being with us and looking forward to your input this morning. Sorry. I want to thank I thought that was just a feed to the press, so I wasn't worried about the microphone. We also want to thank the members of the General Assembly. I saw Chairman Lee Hawkins here with us, Representative Darlene Taylor, Representative Lauren McDonald, one of my floor leaders, Senator Kay Kirkpatrick. I hope I'm not missing anybody else. Leader Will Wade slipped in on us. But just thank you all for being here. Thank you for being a big part of our team on the work that's going on at the Gold Dome in a lot of different ways, it looks like this morning. As you all know, when I first ran for governor, I promised to put hard-working Georgians first, not just when it came to economic opportunity, education, and public safety, but also healthcare access and quality. Out of that promise came the Patients First Act, which passed with the help of the General Assembly and many other people. That landmark legislation opened the door for my administration to pursue innovative Georgia-centric policies to tackle our unique health needs head-on. I'm proud to say that we rejected the top-down, one-size-fits-all approach some promote, and instead chose to treat Georgians as individuals with different strengths, challenges, and healthcare circumstances. Since day one, we have prioritized increasing access and affordability to the care you and others in the medical profession provide by launching Georgia Access under the Office of the Insurance Commissioner. That was followed much more recently by the launch of Georgia Pathways under the Department of Community Health and aided by the Department of Human Services. The numbers speak for themselves. To date, these two programs alone are providing health care coverage for over 714,000 Georgians who fall under 138% of the federal poverty level. To be clear, the rosiest projections for traditional Medicaid expansion estimate 500,000 people under 138% of the federal poverty level would be eligible, not actually enrolled, just eligible. Thanks to Georgia Pathways and Access, we've beaten that number by over 200,000 Georgians and counting. But there are key differences between Georgia's approach and traditional Medicaid expansion. Georgians enrolling in private sector insurance through Georgia Access enjoy better coverage that fits their individual needs. Georgia Access enrollees have more options to choose from. And third, coverage gained through Georgia Access pays our healthcare providers a better reimbursement rate for the care they provide than Medicaid does. I'm also happy to report that enrollment in the private sector exchange has grown from 460,000 just over 5 years ago to well over 1.3 million Georgians today. That includes 400,000 Georgians who were previously on Medicaid and were provided the opportunity to enroll through Georgia Access in a commercial plan during the redetermination process. I want to make sure our friends in the media today hear this. Through Georgia Access, 400,000 Georgians who were previously on Medicaid now have a private sector insurance that provides better coverage with more options while saving taxpayer dollars. But the good news does not stop there. When I first took office, no county in this state had more than 2 health insurance carriers. Today, 87% of counties have 3 or more carriers. And thanks to our hard work and the careful investments we made over the last 6 years through our reinsurance program, premiums are down an average of 11% statewide and 29% in rural Georgia. Here are some other stats you probably haven't heard reported. Georgia currently has the 4th largest individual market for health care coverage in the entire country. When we first started talking about pathways in the beginning of my administration, we knew that over 240,000 individual Georgians could be eligible for the program. Today, that number has decreased to a little under 168,000. Not because we made it harder to get into the program, but because more Georgians are employed and having private health care coverage. I want to emphasize a key point for everyone here today. The goal of Georgia Pathways is not and has never been to keep hundreds of thousands of Georgians on government-run health care forever. I believe that approach is wrong for Georgia, and it fails to actually improve the lives and well-being of the people who elected us. Georgia Pathways was meant to be exactly that, a pathway to an education, a job, a career, and a better life without government assistance. Because I want more Georgians to have health care coverage that fits their needs and empowers them to change their lives for the better. I want people like Luke Seaborn, who you'll hear from today, to have a hand up to achieve their dreams and provide for their loved ones. I want more families to be able to make ends meet and have one less thing to worry about when they sit around the dinner table. And the truth is, we are achieving that goal. We have covered more Georgians with better insurance at a lower cost thanks to the Patients First Act and Georgia Pathways and Access. Those facts are clear and undeniable, even if our friends on the other side of the aisle and their activist allies in the media don't want to admit it. They may want Georgia to look like California or Washington, D.C., but as long as I am governor, we're not looking in the rearview mirror. Finally, today I'm joined by some incredible leaders at the forefront of this progress. And before I turn it over to one of those partners, Commissioner John King, I want to thank John and his team for the work that they're doing that has led us to the state-based exchange that will launch later this year. Last year, I had the honor of signing SB 65, sponsored by Senator Ben Watson, which authorized the creation of the state-based health insurance exchange. This platform will enable hardworking Georgians to compare their health insurance options more easily so they can make the decisions that best fits their family's needs. And just this past week, we received approval to move forward with the launch of that exchange this coming November. Congratulations again, Commissioner King, on this milestone, and I hope you'll share with us more about your team's success with Georgia Access.
Thank you, Governor. Thank you, Governor Kemp. Appreciate the shout out to the team because they've been extraordinary in this effort. When I came to office in 2019, Georgia's marketplace was plagued with limited coverage options, lack of access in rural and underserved communities, and high premiums, contributing to one of the highest uninsured rates in the country. From 2016 to 2019, enrollment in the federal exchange in Georgia declined by 22%, with over 129,000 consumers leaving the market. Fewer than 460,000 Georgians were signed up for the marketplace coverage, while more than 1.3 million of our citizens remain uninsured. In response to the Georgia General Assembly passed and the governor signed the Patients First Act in March 27, 2019. This act granted the authority to pursue innovative strategies under the ACA Section 1332 waiver aimed at providing Georgians with access to high quality, comprehensive, and affordable health care. Georgia's two-part approach was first to implement a reinsurance program to lower premiums and attract more carriers to the marketplace, and then transitioning to the federal exchange to bring oversight of the state's market back to Georgia. The 1332 waiver has been instrumental in reducing healthcare insurance premiums by a statewide average of 10.1 for plan year 2024. The program now includes 10 carriers participating in the reinsurance market, further stabilizing our market and lowering costs. Today, rather than having bare counties counties with consumers with no options, all counties in the state have more than one carrier. Nearly all have 3 or more carriers participating in the marketplace. In addition to the reinsurance effort, for nearly 5 years, the state of Georgia has worked with the federal government to transition Georgia from the reliance on the federal exchange to implementing a state-based exchange. The state-based exchange makes sense for 3 primary reasons. It reduces federal regulatory authority and brings back control back to the state. As an SBE, Georgia will no longer rely on federal government for technology, outreach, enrollment assistance, and plan oversight. It makes financial sense. The funds previously sent to the federal government will now stay in Georgia, collected as user fees, and run and maintain the program, ensuring self-sufficiency. It improves state flexibility. Rather than one-size-fits-all approach, a state-based exchange opens the door to innovative solutions intended to address Georgia-specific issues. In preparing for this transition to state-based exchange in 2022, we committed ourselves to educating citizens in Georgia about why and how they should get covered. Our efforts yielded unprecedented success. Our agency's first statewide public awareness campaign drove 25% growth in enrollment in plan year 2023, which was double the nationwide growth rate. For plan year 2024, Georgia experienced a whopping 48% growth in enrollment compared to the previous year, far outpacing the national average by 30%. Currently, 1.3 million Georgians select health plans, the largest figure ever recorded in Georgia's market, nearly tripling the enrollment from 2019. As the governor said, I'm excited to announce that last week the Centers for Medicaid and Medicare Services confirmed their approval of Georgia Access transition to the state-based exchange. This marks a major milestone in expanding access to quality, affordable health care in Georgia. This transition is a major win for Georgia, but more importantly, it's a great victory for consumers. We are restoring control over our health coverage to the people of Georgia. And starting in November 1st, consumers can visit our website, georgiaaccess.gov, to explore their options and sign up for health coverage. Unlike other state-based exchanges in the country, Georgia consumers will have a true no wrong door approach to shop for and enroll for coverage, whether they use the state-based consumer portal or go directly to an insurance company or a web broker or an agent of their choice. They will have access to quality health plans. What's more, they will have access to the same federal financial assistance they previously enjoyed. And once again, we are engaged in a robust public awareness campaign to get the word out. It may be at a ball game, at a Dollar General, at a local festival, or at your neighborhood YMCA. With more than 150 locations across the state, will be there meeting Georgians where they are and connecting them to get them covered. The implementation of the Patients First Act and the transition to the state-based exchange represents a significant advantage in healthcare for Georgia. We are committed to continuing our efforts to ensure every Georgian has affordable, high-quality health care. And we thank you for that, for the opportunity to roll that program out and explain it a little bit. And I'll turn it over to my partner, Russell Carlson, DCH.
Thank you, General King. Thank you, Governor, First Lady Kemp, for having me here this morning. Also, like General King mentioned, I want to thank you for complimenting the staff who in multi-year efforts like this are so integral. And if I to only highlight the commitment here, I know your longtime loyal friend, you know this already, but our Deputy Commissioner DCH and got engaged this weekend.
Yeah.
But I only bring that up here, Governor, he was still answering my text on Saturday. So
He was answering mine too.
I started mirroring his social media timeline. He was answering Medicaid questions, but God bless you, Grant. Thank you, Governor, First Lady Kemp, for allowing me to join you this morning. The Patients First Act exemplifies Governor Kemp's ongoing commitment to increasing access to quality and affordable health care. I applaud him and the General Assembly for championing this act on behalf of the people of Georgia. Of course, Georgia Access and Georgia Pathways to Coverage are products of the Patients First Act. These programs will continue to work in concert to offer new coverage options that previously didn't exist for many of these individuals. The Pathways program, as you know, targets eligible individuals ages 19 to 64 who have a household income of up to 100% of the federal poverty level, which today is $15,060 for an individual and $25,820 for a family of 3. Now, these are folks who are not otherwise eligible for traditional Medicaid and who perform 80 hours of qualifying activities per month. But it's important to emphasize that these qualifying activities can not only include employment, but also taking college courses or supporting our communities through volunteerism. For these individuals, we are supporting their journey with free health insurance as they go about it. It is expected that Pathways members' financial circumstances improve, the individual will be able to transition to either employer-sponsored insurance or gain private coverage through Georgia Access. And that's a good thing, because what's being created are various pathways to coverage that support Georgians on their pathways to success. So we want more people to know about Pathways. That's why the Georgia Department of Community Health is currently launching a robust, comprehensive awareness and outreach campaign throughout the state. Very much of your efforts, General King. Thank you. Our campaign is inclusive of radio and TV spots on streaming platforms and social media ads. We are reaching metropolitan and rural populations with Pathways ads on digital search engines, public transportation, and more. In fact, our media campaign has already generated approximately 68,000 unique visitors to the new Pathways website since it opened on August 1st. And approximately 1,500 unique visitors have actually clicked on the button on the Pathways website that directs them on how and where to apply for these benefits. In addition, we are taking a boots-on-the-ground approach to community engagement. This includes hosting meetings and providing Pathways informational toolkits to healthcare associations, not-for-profits, and providers, many of which have already distributed those. Thank you. We are collaborating with universities and technical colleges, employers, and other organizations to help promote this program to their constituencies. In fact, between August of this year and January of 25, we have identified and made arrangements to attend more than 80 community and back-to-school events across the state to distribute information and answer questions. And at many of these, our DHS and DFACS partners will participate in these events for on-the-spot application assistance. And we thank Commissioner Brose for making those resources available. In fact, we are literally joining a back-to-school event today at Georgia Southwestern and Americus. And just this past weekend at Dalton State, we encountered 150 interested students as they showed up on campus for the first time. We'll post these events at our pathways.georgia.gov website where you can find more information. But we could use your help too. Community leaders, healthcare advocates, and providers, you help us identify and reach those populations for who could benefit from pathways. You know your communities and constituents better than anyone. Use this email address, georgia.pathways@dch.ga.gov, georgia.pathways@dch.georgia.gov, to connect with us, to guide us, and allow us to put resources where they are needed most across the state. Part of our outreach strategy is also initiating text message and call center campaigns to directly contact thousands of individuals who could be eligible. Notify them of any missing information on their application. And our text campaign includes outreach to 160,000 parents who may be eligible for pathways and have children on Medicaid already today. We're looking to reach about 17,000 SNAP recipients who may qualify for pathways, along with individuals who referred to us from Georgia Access because they are not eligible for subsidies to purchase insurance on the marketplace. Again, we want people to go to pathways.georgia.gov to learn how to apply and spread the word. Through Governor Kemp's support with the funding allocation last December, DCH and DFACS have been able to support traditional Medicaid and pathways application processing through contracted staffing and process improvements. We are making system enhancements to help improve the application experience for all Georgians. Simply put, Georgia Pathways to Coverage is another valuable health coverage option alongside Georgia Access. Governor Kemp has put forth a solid healthcare blueprint with the Patients First Act. I look forward to continuing this collaboration with our friends at the Capitol, Commissioner King, DHS Commissioner Brose, and the citizens of Georgia to innovate with Georgia-centric approaches to healthcare access. Thank you again, Governor Kemp, for your ongoing support and leadership. And as I wrap up, I'd like us to hear from Luke from Jefferson, Georgia, who will share his experience as an actual Pathways member.
My name's Luke Seaborn, 53, and we've been here at the shop at this place since 2018. I bought this off the county, and it's just an old workshop, an old bus barn is what they called it. And we repair and restore old classic Ford and Chevy vehicles. My dad instilled this in me, and I'm trying to do the same with my son. It's this classic vehicles that we qualifies. Of course, I was crossing my fingers, hope to God that we did qualify, we did. But I highly recommend it because, again, it offers that avenue for you to have health insurance where you otherwise would not. And you would have to pay out of pocket for prescriptions, and that's just an added luxury, if you will. Prescriptions shouldn't be luxuries. We need them for our blood pressure and for your eyesight and whatever else that you need prescriptions for. And fortunately, Pathways offers that avenue to attain and even use the doctor that I used before, which amazed me. I didn't have to pick some random doctor. I was able to maintain with my doctor, not that I go all the time, but at the same time, I'm able to use them. And that was great. And it doesn't feel like a luxury anymore because this has helped my son and I, my family. It takes that worry away from us that we otherwise wouldn't have that type of insurance, and it offers us the opportunity to maintain health coverage. And again, these days and times, that's a huge step up. And it's a great jumping off point for us to get better insurance down the line, because currently we have what we have, and it helps us. But as we grow in a business and as we get larger and of course make more money, hopefully, then we'll be able to follow that path with Pathways.
And that's really why we're here today. We want to hear more stories like Luke and make sure that all Georgians that are looking for insurance and opportunities for healthcare coverage understand that there are options out there, even more options than we've ever had before. Russell, before we hear from our CEO heads, can you talk just a little bit? I mentioned the staff and how hard they work, and y'all have had a lot on you with the delay in Pathways from the Biden administration, but also the redetermination process. So thought it might be good just for people to hear about what you all have been dealing with and where we are now versus where we were, 6 months or a year ago, and kind of where you're going from here.
Yes, sir, of course. The delay obviously presented some challenges, to say the least, and I would say two kind of points come to mind. One is the actual year's loss. The 1115 waiver is a 5-year demonstration, and when it's all said and done, we will not have been granted 5 years. We lost around 2 years in this process, and I would say those are formative years. Those are when you're building your systems, when you're, just like General King and I are talking about doing now, when you're running around the state educating both the stakeholders and the potential members, and just getting the process fine-tuned, ready for go live and to get out the door. But I would secondly say, in addition to the 2 years lost, Governor, as you mentioned, that required us, when we did go live, when we did present this to the public, it was in the heart of the redetermination process, where there was unprecedented market movement amongst all people in the healthcare spectrum, providers and users alike, and then also the most tremendous burden on all 56 states and territories going through this redetermination process at the same time. That's all states and territories' eligibility systems, and in Georgia, our eligibility systems, and most importantly, our eligibility workers who are already burdened with so much day to day. So all of those systems overhauls and those education process and the working of cases were all converging at once. And that was a tremendous strain on the system. So that's why we're encouraged with this media campaign. We feel like Georgia Pathways, for the first time, will be granted open seas, if you will. We're able to go out and educate everyone while knowing that Georgia's systems are hopefully in a place, as far as workload, to really be as efficient as we can all be, and get these processed in a timely fashion and educate people on their options along the way. So it was challenging, but I'm like you said earlier, I'm looking forward, and I'm frankly very optimistic about the months ahead.
That's great. I know you mentioned education and other partners, and I know Commissioner Dozier, Technical College System of Georgia, is here with us this morning. Can you just take a couple of minutes, talk about, what your work you're doing with them and other, education institutions to help spread the word?
Yes, sir. Commissioner Dozier and your member institutions, alongside USG and their member institutions, have been great. We really feel like that student population is a tremendous area of focus for us. We know that students are in a period of transition, and yet between their volunteer hours and, again, their course hours, could very well qualify for these programs. And just like so many college students, they may not necessarily be paying attention to this sort of thing until you meet them where they are. So that's why I think the boots on the ground component, running alongside these technology and media enhancements to reach people on social media platforms and other forms of kind of intelligent advertising, I think we'll meet people where they are. And again, I meant that quite literally. Some of our team is in Americus today at Georgia Southwestern. We had good interest at Dalton State And 35 of these touch points between August and September alone during the back-to-school window, and 80 by January. And I meant what I said earlier, too. We're always welcome to more input from you in the field, and if there's a place we need to be, we'll do our best, along with DFACS, to be there, and grateful for the opportunity.
Great. Commissioner King, before I move to the other side of the table, I just wanted to ask you real quick, your thoughts on the state-based exchange. I know we were talking, and when I was getting briefed on everything last week, I said, big picture, tell me what the state-based exchange is going to bring to us. And it's basically more options for people on the marketplace, and it's going to allow us to better market plans. Because as we know, I think when the Affordable Care Act first came out, healthcare.gov, we had a lot of citizens that would be eligible but just wouldn't go to the website. It was too hard to maneuver through there. So you want to talk a little bit about how this Georgia-centric approach is going to be, really better for our citizens?
Yes, Governor, I appreciate the opportunity to expand. The challenge is a matter of scale. The federal government is clearly trying to deal with the whole nation. But Georgia Access and working with the Georgia team, me and Russell talk routinely about how do we transition people that they're going from his program and rolling them right into where they get private, offers for private health from vendors and people who know the product that they're selling. And that's the key, is going and meeting people across the state, having people that can go to Plaza Fiesta and speak Korean, Vietnamese, and Spanish, to go into Dalton, to go into the Valdosta Lowndes County High School football game, meeting people where they're gathering instead of just depending on an internet campaign. Again, there's no wrong door, and that's what makes Georgia a little bit more effective, because we know the state better, and we're partnering with YMCA, with Boys and Girls Club, so that's really has gotten our reach. Really, it's the flexibility and the adaptability, but more importantly, is our private health companies participating in that marketplace, which makes Georgia's plan different than anywhere else in the nation. That we have not only the regular type of healthcare coverage, but we also have private health companies competing for the folks in the individual market, the gig economy, folks that have multiple jobs or work. That's what makes Georgia innovative and be adaptive as Georgia market changes in the future. That's the problem, that the federal government does not have a lot of. They don't adapt well, because they're trying to deal with the whole nation.
Great. All right, we're going to move to our experts over here this morning. Just want to thank Jason, Wade, and Mel for being with us, and thought it would be good for everyone to hear a little bit about what you guys are doing, how you're promoting pathways, and just your work with your respective companies. And Jason, we'll just let you start and then go to Wade and wrap up with Mel.
All right, thank you, Governor. And Governor, I'd just like to thank you, start off by saying thank you for bringing these innovative programs with Commissioner King and Access and Commissioner Carlson with Pathways. They have been phenomenal and covered a lot of folks, right, that were previously uncovered. So really appreciate that. At CareSource, access to care, access to coverage, and Pathways to coverage is key, and one of our tenets to the CareSource mission. So there are really four things that we've done to ensure Georgians across our state have access, knowledge, and are educated about pathways to coverage. First, as Commissioner King and Commissioner Carlson stated, we have met people where they are, out across the state at community events and community forums, in an array of settings. Many of you may have seen in that community setting our Wellness on Wheels program, where we take care to the community. As we take care to the community in mobile health clinics, we also take an educational approach to educate on pathways, to educate on redetermination, to educate on access, and to ensure those Georgians understand how to get that critical access to coverage. Second, and maybe most importantly, we've invested in a dedicated Pathways Navigator. And that dedicated Pathways Navigator is there to ensure folks understand how, not only how to enroll, but how to maintain coverage. And that dedicated Pathways Navigator is part of our fabric of who CareSource is, our life services program that works to break down barriers to care that may be transportation in nature, that may be housing insecurity, food insecurity. But most importantly, right, that navigator sits there to help folks access those pathways and access to care. Third is our community partnerships. That has been really key and critical. And most importantly, where we started with a couple of ones, one highlighted by Goodwill, started in Macon. And Goodwill helps, again, extension of that navigation services into pathways. And it's been very, very successful. We've expanded that Goodwill program and partnership up into the greater metro Macon area, where folks can go, again, where they go for services, where they go for those vital social determinants of health. So those are a couple of ways CareSource has invested and partnered with Department of Community Health at those numerous community events across the state. So thank you, Commissioner, for holding those, inviting us to those events, and allowing us to promote these access and pathways to coverage.
That's great. Thank you, Jason. Wade?
Well,
thanks
good
for being
morning,
with us.
Governor. Thank you so much, Governor Kemp, First Lady, Commissioner King, Commissioner Carlson. Thank you for letting me be here to talk about what we're doing in partnership with the state for this important program. Yeah, Peach State Health Plan's been here since 2006 at the inception of the CMO program, and we've been honored through that time to serve Georgians across all 159 counties. We also operate a health insurance marketplace plan, so this brings so much together to help us take care of our neighbors. Now, Peach State, that's a team of 1,400 folks who live in Georgia, and our motto at Peach State is here for you, here for Georgia. So this program of connecting with our neighbors is infused by those 1,400 individuals that are across the entire state. Now, every single new Pathways member that comes to Peach State gets contact within 7 days. That's done directly by either one of our care navigators or one of our community health workers, who's then going to assess what their broader needs are. Because we not only do that with our team and do that with these departments, but community health centers, hospitals, physicians, nurses, and pharmacists and providers all over our state, 54,000 of them, 300 hospitals, make up the team that takes care of these people. And much as Jason said, we've enjoyed being out in the community. We've done 33 events since the start of the year and engaged thousands of individuals at that event. And we'll have even more to come, because the most important thing for us is ensuring whatever coverage you have, you get the best care, and that every one of my folks at Peach State believes the care has to be the care they want for their loved one or for themselves. So this is an extension of that work we've been proud to do since 2006. So thank you for having us this morning.
Mel, welcome.
Great, thank you. I think Wade said most of the things I was going to say, but in any case, thank you, Governor, thank you, Commissioners, thank you, First Lady, for this opportunity to be here. I think this represents Georgia's deep commitment to ensuring that people have quality health care in our state, while at the same time creating this pathway to employment. I grew up on Medicaid, and I understood I understood the value of having health care, but what I really wanted was a job. Right? I wanted to be able to contribute to my state in meaningful ways. So I commend the governor for not only having the leadership to introduce a program like this, but to create the infrastructure so that folks have an opportunity to grow. And so we cover members in Medicaid and in Medicare and pathways and access, and also through our Blue Cross organization, members who are who work for a living, who might be working for Walmart or Home Depot or those kind of companies. So this entire catcher's mitt, if you will, of folks as they crisscross the continuum of healthcare. We have what we call an employment specialist, and that person engages through members at Pathways and help those members to, through monthly, either through social media, through other kind of outreach activities. We do email, we do text messages, et cetera, and help those members not only who have enrolled to retain their coverage by making sure that they maintain the hours they need to do so, but also helping them in some cases to submit their information, et cetera. So I'm honored to have this opportunity. The gentleman who's on the screen is actually one of our members, and we see members like that across the state all the time, optimistic about the opportunities. They've got this safety net of sorts, but they want so much more, and they want to grow. And we meet members where they are, as both of these gentlemen said. So whatever their particular product is that they're enrolled in, we have an opportunity to do that. But we only do that because the government had just this great vision to provide this opportunity in our state. So I'm honored to be here, and we're honored to have the opportunity to serve as we have, since, as Wade said, since 2006. So thank you.
That's great. Thank you, Mel. Y'all got anything else we missed?
Great conversation.
Anything else?
No,
Anybody
sir.
wanna?
Except go Jackets.
Oh, yeah.
Go Dogs.
Yeah, go Dogs. Well, I've been I told Jason earlier, this would be the opportunity for Florida State to lose to two Georgia teams in a row.
All right, we'll take that. We'll take that. Let's
See what
go.
happens. Let me just thank everybody for being here this morning. I want to thank the members of the media for being here too. We are really trying to raise awareness to the options that we have, so we appreciate you all covering this. We want to thank our many partners like TCSG, all of our other state agencies that have been working, our private sector partners that are out there marketing every day. I want to thank especially Commissioner Carlson, Commissioner King for their good work. And lastly, but certainly not least, I want to thank the members of the General Assembly that are here and those that aren't, that have supported this program, that have continued to invest in things like the reinsurance program that really had brought the private sector marketplace more competition, lower cost, and better options for our citizens, and just the good people that continue to work on pathways. It has been as far as I know, we're the only state in the country that's doing this. It is, a Georgia-centric way of doing things. Being first is not always easy, and we know that as we've had to fight for 2 years to get full approval. And as Commissioner Carlson said, lost a couple of years, but look, we're not going to cry and whine about that. We're going to keep chopping and keep getting people signed up and keep giving people great opportunities in our state. A helping hand, but also the ability to move off of the government-run healthcare into better, really more options and lower cost and have a good, efficient government. So just want to thank you guys for being here this morning. Thank y'all for being on the panel. And with that, we'll wrap it up. So have a great day, everybody. Thank you.
Thank you.